Heroin. The one group of drugs that everyone agrees is dangerous are the hard narcotics, or opiates. Included are opium, morphine, heroin, codeine, methadone, and Demerol. Of these, heroin is the most available and therefore the most addicting and dangerous. What is heroin? Heroin is a potent chemical substance derived from morphine. Morphine is a component of opium, and opium is obtained from the poppy plant. This plant is predominantly grown in Asia, especially in the countries of Turkey and Iran. The plant is processed into heroin, which is then very professionally smuggled into the United States through criminal channels. Heroin, called H, horse, smack, skag, hairy, sugar, or junk, is sold in small packets or fixes of dirty white powder. Subsequently, the drug user heats the powder into liquid form and injects it into a vein. This is called shooting up. What does heroin do to you? Heroin is mostly a pain reliever. In simple terms, it produces a relaxed high and makes the user feel good. However, the effects wear off in about 4 hours, and all the pain returns. Why is heroin so dangerous? Heroin is a dangerous drug for many reasons. First and most significant, heroin is an extremely addictive drug, inducing both physical and mental dependence. Once you shoot up 4 or 5 times, chances are that you will become hooked on the drug. And once you're hooked, you will do anything to get the drug, because if you don't keep taking it in increased doses, painful withdrawal symptoms will start. This is where the term dope fiend got started. Since heroin is an enormously expensive drug, addicts usually have to steal money, even from their friends, in order to support their habit. Current estimates for the United States as a whole are 250,000 hardcore heroin addicts, each of whom needs to steal about $50,000 a year to obtain an adequate amount of heroin. Today, a large percentage of the country's high crime rate is due to desperate heroin addicts trying to get money for more heroin. Second, an overdose of heroin can kill. Heroin interferes with a person's ability to breathe, causing the brain to be deprived of its necessary oxygen. When this occurs, there is very little that can be done, because the unfortunate addict's blood pressure drops so rapidly that he goes into a state of shock. Many addicts die of overdose because there is no way to tell how much heroin is in each dose. In addition, the heroin is usually mixed with other chemicals, any or all of which may cause death. Third, since the heroin addict tends to become careless, there is a good chance that he will stick a dirty syringe into his arm. This can cause a disease known as hepatitis. Hepatitis, very common among narcotic addicts, is a very serious disease which damages the liver and can cause a person to remain in the hospital for months. If the addict does not seek treatment for hepatitis, then he will die. Finally, even if a heroin addict is lucky enough to escape arrest, overdoses, and hepatitis, his weakened condition makes him particularly vulnerable to many other infections, especially pneumonia, tuberculosis, and bronchitis. Heroin addicts rarely live very long. Their lives are short, meaningless, and miserable. In every way, heroin is a sad, lonely journey down a dead-end street.